Okay, so this is going to be a video of why you shouldn't or should go to medical school. I'm making this video because I'm in school and I feel like I've seen people go through the struggles, and I've gone through the struggle myself, and it's really difficult and it's a long chunk of your life. So this video is by no means things that you should talk about in your personal statement or on interviews or something like that. That's your personal experience, the reason why you specifically chose to go into medicine. And I'll sort of touch on that in this video, obviously, but these are sort of the basic themes that I've seen in people and sort of something that I think maybe some things work and some things don't work. And of course there's going to be some obvious ones. And just in general, having gone through medical school, I think there's an idea of the reasons of you choosing to go through medical school that could make you a stronger student. Okay, so first reason why you shouldn't go to medical school is for the money. I mean, this is kind of just obvious. It's expensive because you'll have to take out loans. And even if you don't have to take out loans, it's a long chunk of your life, and it's really difficult if your heart isn't fully into it or you're not strongly academically committed. So there's a lot of ways to make money, and this isn't really even the best one. And reimbursements for certain specialties have sort of been fluctuating. So that's something to keep in mind. A lot of people think going to medicine is like the cush life and I'll just become an orthopedic surgeon and make $500,000 a year, but really it's not like that, because making $500,000 a year as an orthopedic surgeon is tough work. You shouldn't go to medical school just so you can help people. There's a ton of ways to help people. But if you like the study of biology and the human body and want to educate patients, for example, educate them on a diet or how to take medications, educate them on the pathology of their disease in medical screening, then this field is unique to other fields. So I think that's definitely something you should think about, that you're helping them in a certain way. Don't go to medical school because somebody told you to, or you're following people, or all of your friends are doing it so you should do it too. I think this is really important to gauge as you're entering medical school, to see yourself as an independent and not sort of as a follower. Now, you don't by any means have to be a huge gung-ho leader or class president of your undergraduate class or something. Trust me, a lot of people in medical school aren't that person. You should definitely maybe see yourself as an individual. For example, if someone asks you where you live, on one hand you could say, I live with my parents to save money and they feed me. On the other hand, you could say, I'm single right now living on my own. You aren't really lying by saying that, but the emphasis is more sort of on yourself as an individual and independent. Basically, it shows that, do you see yourself as an adult or not? But in the end, you're applying to medical school because you want to, not because someone told you to or you're following your friends. Okay, so reasons why I think you should go to medical school, and again, this is going to totally vary, but number one, I think to genuinely help humans, but also to educate them in the area of biology and pharmacology in human medicine. Remember that your population base has a variety of different education levels, and you need to be able to translate medical terminology in the way that a lot of people understand, like the average individual. So if you don't really have the patience for that, or find that you don't really want to do that, you may not like medicine as much, and this may become an issue. Now, I'm not saying every field requires you to necessarily talk to or educate patients, because some specialties of medicine are so different. Like, they're like different careers, basically. Well, obviously. Like, an orthopedic surgeon is totally different from a pathologist. For example, like, a pathologist doesn't really have to talk to patients if you don't really want to, and while an orthopedic surgeon really has to educate patients post a knee replacement on stretching and how to take care of themselves. So on and so forth. I would say before starting school or even deciding is to at least see a bunch of different, maybe at least a few different specialties, because they're so vastly different. Now, I'm not saying you need to have an idea of exactly what you want to do going into medical school. I know a lot of people who weren't. I wasn't one of those people. But if your only experience of medicine is going to your family practice doctor, remember that there's a lot of other specialties that you could see and that may fit your personality more or may fit what you want to do more. But just in general, number one was to generally help humans, and then in some of the fields be educating people in the area of biology. So you're going to be learning a lot of biology and pharmacology and anatomy and so on in the first 4 years of medical school. Everybody has to learn that, no matter what specialty you end up going into. I guess at the end of the day, you need to have the patience to be able to educate people and want to help via the study of biology. I think that's kind of important. Number two, and I think this is super important, is that you had your own experience, and it helps you put you in the context of medicine and puts you at a level of empathy that you can have to relate to patients. It also keeps you driven to help others. I should at least share my experience. And the reason why I'm going to medical school is because when I was a teenager, I had appendicitis and I had ruptured, and it was super painful. I had to go into surgery, and that was really significant for me. And so I was on that side of the curtain, and my end goal was to be on the other side of the curtain to help other people who were going through the same things that I went through. And I would say during my hardships during medicine, I would always think back to how much it hurt. And then when I talk to patients during rotations at the hospital, I just am able to empathize with people in pain, and able to empathize and able to relate when they don't really understand the medical jargon. Because I've been there. Again, you don't necessarily need to have like some sort of crazy experience with death or something like that. I just think some experience, maybe to help you put it into context of what a patient's going through, I think would really help. Number three is a little more specific, and it's that you want to research medical pathology to further our diagnostic and treatment capabilities in medicine. And this is a little bit more difficult to relate to if you haven't really done research or don't really like research, but I think it's emphasized because we really wouldn't be where we are today without medical research. Obviously, everything that we do is what we call evidence-based, and it's based off of research studies, both benchwork studies, whether it be in the field of pharmacology, but also clinical studies like studying epidemiology and the outcomes of certain surgical procedures. And that's something that you can obviously research more during medical school, like I did. But if you did sort of enjoy research, and I know bench research for some people can be kind of boring, that's usually what you're gonna encounter during undergrad. But definitely a lot more opportunities will open up when you go into medical school for doing research. And again, if you're interested in it, I think that's a really good reason to go into medicine. Okay, so those were just really in general shouldn'ts and should. Of course, there's a slew of other reasons why you should or shouldn't go into medical school, and then your personal experience or some sort of anecdote of your own, I think will really hone in whether or not you should choose to apply to medical school. For those of you who are pre-med, good luck. Hopefully I didn't turn down some people, and maybe I helped convince some people to do medicine. It's a long 4 years, it can be expensive, but it's very rewarding, and I think it's the best field ever. I guess I'm a little biased in that. But anyways, thanks.